April 1945. A field hospital near the Elbe River. The tent smelled of disinfectant and wet canvas. Outside, the spring rain fell in steady sheets, drumming against the stretched fabric with a sound like distant gunfire. Inside, rows of cots stretched into shadow, each occupied by a body in various stages of repair. Soldiers mostly, British and American, but also a scattering of German prisoners, men and women both, who had been brought in from the collapsing front lines to the east. Lieutenant Sarah Brennan, a nurse from Boston, serving with the U.S. Army Nurse Corps, moved through the rows with practiced efficiency. 26 years old, dark-haired, exhausted in a way that had become her permanent condition. She had landed in France 3 months after D-Day, had worked in field hospitals from the Ardennes to the Rhine, and had learned to treat shrapnel wounds and frostbite and infections with the same mechanical precision with which she had once arranged flowers in her mother's kitchen. The war had trained her to see bodies as problems to be solved, bleeding to be stopped, bones to be set, infections to be fought, and to keep the humanity of her patients at a manageable distance, because to feel too much was to become useless. At the far end of the tent, near the canvas partition that separated the women's section from the main ward, a German prisoner sat on the edge of a cot. She was young, 19, perhaps 20, with blonde hair cropped short in the practical style of the Blitzmädchen, the female radio operators and communications auxiliaries who had been drawn into the Wehrmacht's machinery as manpower reserves dwindled. Her uniform tunic was torn at the shoulder, crusted with dried blood and mud. Her eyes, pale gray, stared at nothing. Her name was Anneliese Hartmann. She had been captured 2 days earlier, pulled from the wreckage of a communications truck that had been strafed by American P-47s on a road south of Magdeburg. 3 of her unit had died in the attack. She had survived with a dislocated shoulder, lacerations across her arms and back, and something else, something the intake medic had noted on her chart with clinical brevity. Patient resistive to physical examination, possible trauma. Brennan approached the cot with her medical kit in hand. The girl, and she was a girl, really, barely older than Brennan's youngest sister, looked up as the nurse drew near. There was no defiance in her expression, no hatred, only a kind of blank, exhausted wariness. "I need to examine your injuries," Brennan said in careful, slow English. She had picked up a little German in the past months, enough to give basic commands, but she was not confident in her pronunciation. "Your shoulder, your back." Anneliese did not move. Her hands, resting in her lap, clenched slightly. Brennan tried again, this time in halting German. "Ich muss deine Verletzungen untersuchen." I need to examine your injuries. Still nothing. The girl's breathing had quickened, her chest rising and falling in shallow, rapid movements. Brennan set down her kit and knelt in front of the cot, bringing herself to eye level. She had learned over the months of treating prisoners that the posture mattered. Standing over someone made them feel powerless, trapped. Kneeling, paradoxically, gave them space to breathe. "I'm not going to hurt you," Brennan said softly. "I'm a nurse. I'm here to help." Anneliese's eyes focused on her for the first time. Her lips moved, shaping words in German that came out barely above a whisper. "Bitte nicht dort anfassen." Brennan did not understand. She had caught the word bitte, please, but the rest was lost. She leaned closer. "I don't understand. Can you say it again?" Anneliese closed her eyes. Her hands trembled. When she spoke again, her voice was clearer, each word careful and deliberate, as if speaking required enormous effort. "Please don't touch me there." She gestured, hesitantly, toward her lower abdomen, her right side, the place where her tunic was torn and stained with something darker than mud. Brennan felt a cold weight settle in her stomach. She had seen this before, the reluctance, the fear, the shame. She had treated rape victims in France, in Belgium, women who had been caught in the chaos of liberation and occupation. But this was different. This was an enemy combatant, a German, someone who should have been the perpetrator in the narrative Brennan had absorbed through years of newsreels and propaganda. This was not supposed to happen. "I need to see," Brennan said quietly. "If you're injured, if there's an infection, it could kill you. Do you understand?" Annalise opened her eyes. For a long moment, she simply stared at the nurse. Then, slowly, she nodded. Brennan reached for the hem of the tunic. Her hands were steady. Years of training had taught her to keep them steady, but her mind was racing, already cataloging the possibilities, the injuries she might find. Annalise flinched as the fabric lifted, then forced herself still. Brennan peeled back the tunic, exposing the pale, bruised skin beneath. What she saw made her stop breathing. There, carved into the flesh of the girl's lower right abdomen, just above the hip bone, were letters. Not random marks, not jagged tears of shrapnel, but deliberate, careful letters, cut with something sharp, a knife probably, or a piece of broken glass. The wounds were several days old, the scabbed edge red and inflamed with the beginning of infection. The letters spelled a single word in crude, uneven capitals. Hure, whore. Brennan had been a nurse for 3 years. She had seen men torn apart by artillery, burned by white phosphorus, frozen to death in foxholes. She had amputated limbs and packed wounds with sulfa powder and held soldiers as they died. She had thought, somewhere in the back of her mind, that she had seen everything the war could do to a human body. She was wrong. She sat back on her heels, the tunic still clutched in her hands, unable to speak. The girl watched her with those pale gray eyes, waiting for judgment, for disgust, for the confirmation that she was worthless. Brennan forced herself to breathe, to think, to move past the shock and into the clinical space where she could function. She set the tunic aside, reached for her kit, and pulled out a bottle of iodine and a clean cloth. "Who did this to you?" she asked. Her voice was steady, but something had cracked inside her, some protective barrier between herself and the full horror of what she was seeing. Annalise looked away. "Es spielt keine Rolle. It doesn't matter." "It does matter," Brennan said, though she was not sure the girl understood. She began to clean the wound, her movements gentle, methodical. Annalise hissed in pain, but did not pull away. "Who did this to you?" The girl was silent for a long time. Then, in a voice so soft Brennan almost missed it, she whispered, "Meine eigenen Leute," my own people. To understand the context of this moment, the savagery, the shame, the profound betrayal embedded in that carved word, hure, whore, it is necessary to examine the collapse of the Third Reich in the spring of 1945 and the particular hell that German women, especially those in uniform, experienced as the regime disintegrated. By April 1945, the Wehrmacht was no longer a functional military force. It was a collection of shattered units, unorganized remnants, old men and boys pressed into service alongside hardened veterans who knew the war was lost. The Eastern Front had collapsed entirely. Soviet forces were advancing on Berlin. In the West, American and British armies had crossed the Rhine and were driving deep into the German heartland. The Nazi leadership, increasingly detached from reality, issued orders for fanatical resistance, for the defense of every village and town, for the sacrifice of the last German life in the name of the fatherland. But on the ground, among the soldiers and civilians caught in the grinder of defeat, a different reality prevailed. Desertion was rampant.
Units dissolved, officers fled, and in the chaos, the structures of discipline and order that had held the Wehrmacht together, brutal and authoritarian as they were, began to break down entirely. German women in uniform occupied a uniquely vulnerable position in this collapse. They had been recruited in large numbers as the war dragged on and casualties mounted. Hundreds of thousands of them, serving as radio operators, clerks, nurses, anti-aircraft auxiliaries, communications specialists. They had been told they were serving the fatherland, that their work was essential, that they were part of the great struggle for national survival. They had been given uniforms, ranks, a veneer of military legitimacy, but they had never been truly integrated into the military hierarchy. They held no official combat roles.